Laura mentioned. So my name is Desalegn, and currently I'm working as Associate Regional Director for the Ohio State University Global One Health Initiative. Regional office is here in Addis, but we work regionally in Eastern Africa. So I'm currently the Associate Regional Director, as well as I also coordinate Tartar project and work on other projects. So I would like to share my experience of leadership experience in higher education. So to mention my experience in higher education in Ethiopia, I was serving as president of the University of Gondar. That was my last position in my experience at Gondar. I served for 4 years. And also I was president of the Forum of Universities in Amara region. There are 10 member universities, as well as previous to that, I served as vice president for academic research and comm services for some 7 years. And I was also a Fulbright scholar at the Ohio State University. I worked very closely with Wandasan Gabrayes. I had a great experience while I was a fellow at Ohio State. I was able to attend different meetings with Wandasan and different deans, health science college deans and other deans, presidents, vice presidents. So it was a great opportunity to network and to connect colleagues and people at Ohio State to University of Gondar, as well as I served as Higher Education Global Dialogue Fellow at NAFSA. NAFSA is the biggest higher education association in the United States. I used to make presentations about African and Ethiopian higher education, as well as I was a higher education training fellow at the University of Wits at the Republic of South Africa. And I served for different positions in Ethiopia. Just to share some tips on my experience, when I joined the University of Gondar, I had working for the last at least 12 years in leadership and 14 years totally. I had different experiences, observations, and
Dr. Desalegn, I'm sorry to interrupt you. Could you please share the PowerPoint presentation in play mode?
Sorry.
No problem.
Are you not able to see the
top left play?
Yeah, the top that top left corner. On the other side.
Go to the left, Desalegn. Go to keep going to the right there. Almost. Keep going left. Right there, just below. Yeah.
There you go. Thank you.
So yeah.
No
So
problem.
so as a new leader, in any organization, leaders need to understand, need to have a deep knowledge of the history, the vision and mission, the policies and strategies of that organization, the governance structure, programs and projects, the human resource infrastructure, facilities, financial resources, any partnerships and collaboration. So in the US, usually you go with your own vision, with your own plan. But in Ethiopia, sometimes you may be working at any position in the university or out of the university. So you may join, you may be appointed or elected. So you need to, you may have your vision, but you need to understand the existing vision. And every university has its own history. So you need to understand all physical infrastructure, facilities, projects, and human resource, everything. So it helps you to start where to start, for the future, and it helps you to lead by knowledge. You need to have a clear knowledge about the university. Sorry. I was not able to go to the next slide. Yeah. Excuse me. Yeah, okay. So sorry for that. So the other is you need to understand, you know, the you need to have an analysis of that institution. You know, once you try to understand what is you know going on, you need to also understand, you know, the strengths of the university, weaknesses, opportunities, and threats. And institutional culture, you know, understanding institutional culture is very important, as well as externally, you need to understand, you know, the existing national policies and strategies. For example, as a university, we need to understand, you know, higher education policies, you know, health policies, agriculture, environment, because we are involved in producing graduates, you know. So in understanding the national policies and strategies will help us to strategize our programs, both undergraduate and graduate. So always, you know, understanding policies and strategies will help us, you know, what to do in line with the national needs, and also understanding the surrounding community needs. Sometimes we are living in campus, but, you know, out of the immediate campus, there are communities which are suffering from, you know, different health problems, you know, poverty, and other problems. So we need to understand, you know, our surrounding, and also, you know, national policy and strategy. So this will help us, you know, strategizing and prioritizing our focus. So once you try to scan, you know, the environment, you know, internal and external environment, you can start your strategy. So developing your strategy. While developing strategy, you are not doing it by yourself. You are doing it with colleagues, you know, your team. So your vision drives your strategy. You know, what are you planning to move your organization into the next level? So I told you, I talked about, you know, understanding the existing vision, understanding all information in that organization, and then you need to start, you know, developing your vision as a new leader for the organization. And while developing your strategy, our strategy, we need to make sure that, you know, our team is already involved. And we have to make sure that, as I said, you know, our strategy addresses government policies and strategies, and public needs, and global and local trends. As for example, you know, our GOHi's mission and vision is you know, making at a global level. You know, we know that, you know, health systems at local level, national level, and global level. So we're trying to work, you know, on health systems globally to contribute toward this global health. So our strategy, you know, involves, you know, understanding global trends, you know, national needs, and public needs. And we need to also make, you know, strategic communications. You know, when always speaks about, you know, the mission and vision of GOHi, and tries to communicate every time. So every leader, you know, every people working at higher levels, and even at any level, need to make strategic communication. So while communicating, we make our vision very clear to our team, as well as to our partners, our collaborators, and everyone we are working with. And also it helps to create an ownership to employees. So whenever we are sharing our vision, whenever we are sharing our strategies, people, every day by day, people start to own it and to understand it. So it helps us to better implement the strategies and plans. So while communication, for example, as GOHi, we talk about mission, vision, and currently we are talking about business plan, how we are going to function in this changing world, how to sustain ourselves and how to make a grassroots impact. So communication is always, sharing your vision and mission and your strategies. Sorry again. Yeah. The other is we need to foster teamwork. We need to show the power of teamwork. Once we are communicating our team about our vision or our mission, and we need to start, making people work together as a team, function as a team. And we can build strong teams at all levels, higher levels, middle level, lower level. So depending on their level of work, we need to establish a teamwork. We need to empower our teams. And we need to decentralize power as necessary. There are different levels of work, different structures. Whenever we give autonomy to the lower levels, we need to make sure that we are giving autonomy with accountability. People need to understand, what the authority they have, the responsibilities they have, and they need to be accountable for what they do. And we need to also keep the balance. In my experience, while we started, developing a decentralization guideline. That guideline tells, how the autonomy of people at different levels. But we need to keep the balance. Sometimes, most of the work will be at the top, and people on the lower positions are expecting orders every time. And sometimes we give more power and to the lower levels. And whenever we try to decentralize, we just give more authority and responsibility and whatever. But sometimes we need to balance, extreme decentralization without accountability and without control will be, losing a kind of autonomy by the upper leaders. Sometimes everybody talks and nobody will be hearing. So it's important that, to keep the balance while we decentralize responsibilities. And whenever we give autonomy with accountability, we need to show our trust and confidence to the teams we are giving autonomy. And also, one of my experiences is, visiting teams at work. So this is really important. We need to take some time to visit and listen our teams on the job, and we need to show our great appreciation for what they do, and appreciate their contributions towards the mission and the vision of the organization. And also, we need to identify, whenever we talk to them, they may say, we have such problems and challenges while we do the work. So we need to identify those problems, and we need to solve those problems. And we need to also share experience. I remember, I used to visit, because I live in campus, I used to visit, for example, our library works for 24 hours. So I used to visit, the library in the middle of the night, how the library people are doing their job, and I visit the hospital, I visit people in the engineering department, everywhere. So people are very much happy, whenever we are physically present, asking them what they are doing, and giving appreciations for what they do. So we need to, build also our team's capacity. We need to identify areas of improvement, both in terms of individuals as well as in terms of teams. There is, whenever we build a capacity, we can talk of, competence as well as character. These days, soft skills are becoming more important. The way we communicate, the way we work with people is really important than the hard skills that we have. So it's always teamwork, and when to have a very good teamwork, we need to have a very good capacity of leadership. There are always team leaders. Of course, everybody works as a team, but there are always team leaders in any department or college. So providing leadership and training, leadership and management training, as well as there are always newcomers. We need to continuously give trainings to our policies and strategies, and we need to also provide training, planning and reporting skills. So there is always teamwork. They need to report what they are doing. They need to plan. So we need to make sure that we are giving the necessary guidance towards planning and reporting. So this is what we have been doing, and the trainings we provide, where once we identify the areas that we need to give training, we need to identify an excellent training facilitator. And we have to make sure that the training is based on context. For example, higher education is different from a bank. So in any training, leadership training should be given in context, in that business context. So we have to make sure that. And as a leader, always leaders should moderate trainings and intervene as necessary. So whenever we moderate trainings, we shape the training to the right position. Sometimes trainers they do have the knowledge, but they don't understand the real ground, so the real context. So as a leader, we have to be in between, facilitating, moderating the training, and that gives us a chance to share our vision, to share our mission, to make people speak out what we are planning, how to do it. So always, rather than some people, I in my experience, they open a training, make an opening speech, and they leave the room, and they come back for closing, but they don't know what people have been talking about, what kind of training have been given. It's always to moderate. I know Wanderson has always been there whenever GOHi's capacity building series of trainings have been given. So asking questions, giving examples or live examples of the organization, and shaping towards the right direction is really important. And as I said, this gives a chance for leaders to the mission and vision, and also get feedbacks about the training, and also provide supportive supervision. So once the training is given, we need to make sure that the team is doing the right thing. So
Dr. Desalegn, I just want to let you know you have about 4 minutes, and then we'll go ahead and take 1 or 2 questions before Amanda Berrien takes over.
Sure, yeah.
Thank you.
So, Yeah, so shall I take questions or?
You have about 3 minutes if you want to continue, and then we'll take questions.
Sure. So the other is coaching and mentorship. You know, we need to have, you know, coaching and to build capacity as well as create ownership, responsibility, and accountability, as well as it really improves organizational culture and improves, you know, performance. You know, improving knowledge, skill, attitude, and also it becomes like an experience sharing platform. In general, mentorship and coaching is one of the capacity building that transforms overall organizational structure and performance. The other is the power of listening. As a leader, we need to make sure that we're listening to our team, you know, what they are saying, you know, telling stories and challenges. And once we listen and whenever we respond, we need to focus on strategic issues rather than answering question by question. It's good to focus, you know, strategically, so that you give more messages than, you know, answering questions, and it gives we can give also clear answers. You know, decision making is important. You know, people or your team need to understand you are really a decision maker. So whenever they are asking questions, you know, they know that you are going to answer their questions. So decision making is a good quality of a leader. As well as communication is important. As I said, you know, in order to share your mission, your vision, your strategies, communication is really important. So communication is an important part of capacity building as well as leadership. Socialization is also important. You need to socialize with people. You need to understand, because you know, we're living together, and people face, you know, bad and good times. So we need to show empathy, and that improves the relationship and teamwork in office. So people don't ignore socialization, the value of socialization, but in my experience, it has helped me a lot to bring together the deans and vice presidents and directors, so that they interact together, and it improves the relationship. Final is leading by example. So whenever you speak about your vision, whenever you show your commitment, your hard work, your dedication, discipline, and work ethic, your confidence, and your respect towards your team, and you know, this all motivates people. You know, you'll teach them whenever you do, rather than whenever you are telling them. So leading by example is, you know, it's just, you know, showing whenever you are doing your work in excellent condition, people will follow you rather than telling them what to do. So thank you so much. You know, I can have some questions. Laura?
Yes, thank you. So thank you for your presentation, Alan. If you have a question, could you please raise your hand? It looks like we have one from Dr. Zelalem. And you can also send me a message in chat. So we'll go ahead and let Dr. Zelalem ask his question.
Okay, thank you, Dr. Desali. My question is, I just want to ask, what would be the role of university leadership in crises like the one we have now, like coronavirus outbreaks? What is the role of university leadership from your experience in Ethiopia? The other thing is, I always see regional leaders, university leadership. Even in your case, you have a very good collaboration with, for example, Ohio State University while you were Gondar University president. Is there any collaboration regionally between African countries without the involvement of Western university to strengthen partnership and capacity building locally? Can you give me an example? I always really wonder about this. Thank you.
Yeah, thank you, Zelalem. With respect to your first question, you know, yes, the last couple of days I was talking with some university presidents it seems that people are not understanding their role in terms of contributing towards the current crisis. When I was reading the history of University of Gondar when I was in Gondar, I get literature that in the 1950s the college Gondar College students have been able to go to the field to give vaccination whenever there was an outbreak. So it was in Gondar, most of the vaccination, it was they were able to manage because of the contribution of the students, closing classes and sending the students to the field. So I was talking the same thing about the issue to some of the university presidents, and they are somehow starting. Gondar is very close, and they are starting working with the regional and the zonal health departments. Amara region has selected Gondar as one of the corona diagnostic sites, and I think they are working. And every other university should work in terms of communication, in terms of working collaboratively. And on your next question, our work with working with African universities, there are some collaborations, but usually collaborations are north-south. University collaborations are north-south, like with Europe, like with Canada, United States. But there are few examples, like we work with Kenya on leishmaniasis, for example. We work with University of Nairobi, as well as University of Khartoum, because leishmania is a problem in Eastern Africa. There are some examples with Kenya, with Tanzania, with Uganda, as well as Sudan. But comparing to the North-South collaboration, it's not as such, strong. So universities in Africa, I can say, are not collaborating to each other, and most of them are looking toward this North-South collaboration.
Thank you.
Thank you. We have time for one more quick question from Dr. Kathy Culberson. She says, thank you for your presentation. You mentioned identifying skilled facilitators on a couple of slides. Do you have a capacity development program in place to build facilitation skills in your team?
Actually, we have been providing, while I was there, we have been providing different trainings. Those trainings include like leadership, teamwork, and strategic planning, strategic communication, whatever. So in the middle of all these leadership trainings, we have been selecting facilitators who can work, who can facilitate these trainings. But we are coordinating with facilitators coming from another place as well as within the university. But specifically for facilitation, I don't remember. But we select facilitators who have the experience, but we are not targeting towards facilitation skills. It's a good point.
Thank you very much, Desalan. I'm just happy to chat with you privately if you'd like to talk more about it.
Yeah, thank you.
Thank you very much, Dr. Desalan. And with that, we'll go ahead and hand it over to Dr. Amanda Berrien. Whenever you're ready.
Okay, fantastic. Can everybody see my screen and hear me okay?
Yes.
Okay, fantastic. Well, thank you so much to GOHi for the invitation to present a little bit about my thoughts and activities in this realm of capacity building. So I called my presentation today, One Health Capacity Building, a Path to an Enduring Global Community. I am an assistant professor currently in the Department of Veterinary Preventive Medicine here at The Ohio State University. Also the Associate Director of Veterinary Public Health Program. And I'm going to share a couple of the activities that I've been involved in recently since coming to Ohio State, which have definitely involved a lot of partnership with the University of Gondar. So it's great that, thank you, Dr. Desalan, for your presentation, which I think should complement nicely with what I'm planning to talk about today. So when we think about capacity building, I always come back to this quote, which is that give a man a fish, feed him for a day, teach a man to fish, feed him for a lifetime. When we think about what capacity building is, it's really intended to have that long-term effect, that prolonged positive benefit. It's not intended to be a single intervention to have a one-time benefit. And it doesn't necessarily have to always be teaching or educational related, but certainly education is a great way to sustainably build capacity. So what I hope to talk about a little bit today is my thoughts on capacity building, and specifically for One Health interventions and programs, what it is, and because that term is something that's used quite often, who can it involve and why do we do it? And then I'm going to provide a bit of an illustrative example of some of the activities that I'm currently involved in, and with a big caveat here that capacity building is by nature a significant team effort, as Dr. Desalin mentioned as well. So if we're able to have any positive benefit and success in this field of capacity building, it's only because we stand on the shoulder of giants and we have a huge team that's involved with the work that we do, including teams here as well as our partners abroad. So I do want to emphasize as well the Global One Health Initiative. Its capacity building is really central to the mission. So this is the mission statement taken directly from our website, which is expand capacity for a One Health approach via applied education, training, research, and outreach to more efficiently and effectively address causes and effects of diseases at the interface of humans, animals, plants, and the environment. So that mission statement is essentially the definition of One Health capacity building. So that expanding capacity via variety. And they even mention efficiently and effectively. So increasing the efficiency and increasing the effectiveness of these types of projects that we do to try to promote and benefit health for all. As I mentioned, capacity building, it's a commonly used term. I've actually kind of myself have gotten away from using the term building so much, and I've tended to like more of the term capacity strengthening, because oftentimes when we're involved in capacity building work, we're starting with something, or not usually starting from scratch. And so we're building and we're strengthening, I should say, what's already there to try to promote those sustained benefits. And that can happen through a variety of different types of activities, whether it's training or skills development, coaching, and infrastructure support or planning activities. So more specifically thinking about capacity building for health, again, really the emphasis on building sustainable skills and organizational structures and trying to build and improve resources in order to have this long-term, prolonged, and multiplied effects on health over time. And the idea is that through the building of capacity of either people, communities, organizations, we'll be able to improve the efficiency and effectiveness. And again, think back to that GOHi mission statement. They really nailed the definition of capacity building there to expand reach or the scale of capacity building efforts, leverage resources, and enhance competency. And we'll touch a little bit on what competencies we're talking about specifically for One Health. So thinking about capacity building for One Health, I go back to the require some type of technical and disciplinary expertise in each of these disciplinary sectors. But we can't forget about those shared competencies or those cross-cutting competencies across those disciplinary areas. And there's been lots of activity looking at what are some of those cross-cutting core competencies, and they include things like being able to work across boundaries, and that includes both disciplinary boundaries as well as national boundaries, communication and diplomacy, being able to be an effective leader, and that involves having professionalism and ethics, having visionary leadership, thinking broadly in terms of systems, and obviously having cultural competence. So when we think about One Health capacity building, we have to be constantly thinking about, are we building technical competencies along with these cross-cutting core One Health competencies? So who should we target when we're thinking about building capacity? Well, it could be targeting individuals. This picture is from a capacity building effort that I was involved in rural South Africa, where we were working with communities to empower local communities to learn how to do infection control at the animal-human interface. So this is an example of a direct capacity building effort that has this bottom-up effect. But we can also work from more of a top-down organizational institutional role, where we're building capacity from the top down and changing policies or institutional structures so that those benefits of those built capacities trickle down. Why do we build capacity? Well, hopefully, like we said, those long-term sustained gains and specifically improved health outcomes. And essentially, capacity building is really this implementation science. We think about taking our research or taking the work that we're doing in our disciplinary silos, perhaps, and moving them into from the what to the so what. So how can we implement them? How can we reduce that no-do gap so that we're getting what we know out into the world where it can have the most benefit? So this is a cycle, the project implementation cycle that I developed, although I know it's not an original creation. A lot of people use something similar when they're thinking about their own projects. But thinking about capacity building as a project or something that you're involved in that you need to continually evaluate, where do you start and where do you go about the process of capacity building? I think about it much like I do any other project. So it has a systematic effort and it's continuously going around the cycle. So it always starts with an invitation. Backward design model where we're thinking about the objectives or the end, keeping the end in mind. So that's really important for capacity building as well, is thinking about what are the needs assessment, what are our learning objectives or objectives for the intervention, what available resources do we have to work with. That's really making sure we're being systematic and using evidence-based approaches to achieve our outlined objectives. Number 4, planning, obviously important before you go forward with implementation. Number 6, monitoring and evaluation. It's really important for capacity building work. There needs to be interim, short-term evaluations and monitoring, as well as long-term, to determine not only are you meeting your outcomes, but also what impact are you having. And then number 7, reporting and reflection. So reporting is really important for the direct people that you're working with, but also for the broader community. If we are to continually inform capacity building efforts, we really need to make sure that those evidence-based strategies are made public and made known so that we can use those evidence-based strategies going forward to continually improve our processes. So I'll use this cycle and, as I mentioned, go through an example of a capacity building project that Ohio State has been involved in with a partner of University of Gondar, and continually go back to the cycle to show how this process has been implemented. So the example I wanted to talk about was the World Organization for Animal Health, the OIE, Veterinary Education Twinning Program. So this was launched in 2013. And the OIE essentially came out and said that they developed a set of day one competencies for graduates, understanding that veterinary services were critically important to the health and well-being and economic stability of countries all around the world. And I think that's been more realized even in present day, how important our animal populations are for human health. And so they developed a set of day one graduate veterinary competencies, and those include things like epidemiology, like you see to the side there, transboundary animal diseases, zoonotic diseases, animal welfare, and communication. And what they did in 2013 was made a broad call for veterinary educational establishments that were interested in being a part of this twinning project to come forward and see if they wanted to be paired up. Institutions from developed and developing countries could be paired up to really share and leverage existing resources to try to help and make sure all the institutions around the world were able to meet these day one competencies. So University of Gondar came forward and are really an ideal institution to be involved with veterinary educational system strengthening because of the importance of agriculture to the economy, the second most populous country in Africa, and 40% or more of the GDP is related to agriculture, and much of the workforce is involved in agriculture. So obviously a very significant a role that veterinary services are playing. And the University of, Ohio State University as well, being an ideal partner, their global reach through the Global One Health Initiative, as well as other disciplinary activities around the world, and having a top-ranked veterinary educational institution made for an ideal partner. And the fact that these two institutions had partnered and had a really strong relationship before, very much thanks to GOHi and the activities that they have promoted and supported, such as the One Health Summer Institute and other faculty exchange activities. So these two institutions were partnered as part of the veterinary education twinning program. So that's really the invitation part. And then next we talk about this number 2, which is identifying these critical needs and objectives. So how this was done was through what we're talking about education is often through a curricular evaluation. So as part of the twinning project, we developed an evaluation tool that was very much in line with the day 1 competencies that were put forth by the OIE, and did a series of faculty retreats in order to understand what the stakeholders were involved, the faculty, the students, and employers of veterinarian were thinking about the competencies of veterinary graduates, and use those results to essentially establish a curriculum gap report in order to identify what some of those most pressing needs were. And then looking at number 3 and 4, so how can we select the evidence-based strategies and plan for implementation? So for that stage, we looked to what's called a focus forward activity. So this was for those not familiar with focus forward methodology, this is essentially where you specific objectives and or problems and are tasked with coming up with innovative solutions. So that's where that visionary leadership is really important for the One Health competencies, and thinking about how those objectives can be met in some really forward thinking and innovative ways. And so that led to what was called the Twinning Action Plan. And going back to our project cycle, so then we have monitoring and evaluation and implementation. So implementation of some of the changes that were identified through the twinning program were things like changes to course structure and faculty development. And here's the next slide that talks about some of those human resource development that was implemented, and included things like the One Health Summer Institute and faculty and student exchanges, as well as opportunities for collaboration at events such as the workshops and conferences. And then regarding interim and short-term evaluation, so we're still in the process of this twinning partnership between the two institutions. And essentially what this involved was a redoing of the evaluation tool that we initially started with to determine how we were making progress with regards to identifying for those gaps that were previously identified, if you're making progress in closing some of those gaps. And the results of that are still pending, and we hope to look at what that was telling us and go back to our project implementation cycle and identify, again, continuously looking back at if there are specific needs, even in interim evaluation, that we could address going forward. So the exciting thing about this project, as I say, we're still in the midst of it. There's been a lot of people involved. I want to say a big thank you and congratulations. The team, veterinary education, General Veterinary Medical Education, JVME, recently, as regards to reporting and monitoring of progress in the twinning program, made a call for papers to try to fill some of these needs that are very much needed in educational capacity development. So they have requested a call for papers in the twinning project for how we can contribute to this evidence-based methodology. So we recently had a paper accepted, and these are all some of the authors that were on the paper and some of them on this call, I believe. So the team is quite large, as I mentioned. So I mentioned that there are a lot of people that are involved in making this project a success, and hopefully the lessons that we've learned can be put forth to the broader global audience so that other institutions can implement similar types of methodology and strategies for curriculum development and assessment. Okay, so then as I hopefully with any capacity building project and work, it's just a circle. So once you make one milestone, it's on to the next. And it's exciting to see where these types of projects can go. And we're very fortunate that we have been able to be involved in continuing this activity through even a broader type of capacity building project. So this initial partnership, which started off with the University of Gondar and Ohio State, has now grown to an even larger collaboration involving more institutions in trying to leverage the resources and the knowledge that we've learned from our partnership to try to improve and really improve effectiveness and efficiency and leverage the resources, all those things that capacity building can do. In order to benefit more educational establishments all over the world. And the way we're doing that is through the Day One platform for veterinary education. So this is a new project. It's funded through the Bill and Melinda Gates Foundation, and the lead of this project is the Center for Food Security and Public Health through Iowa State University, and involves other university partners, Massey University in New Zealand, as well as the Royal University of Agriculture in Cambodia. And the idea is that we're going to develop an online platform where some of the resources that we've developed as part of the twinning project, so the evaluation tool being one of them, will be housed on an online platform so that any educational institution all over the world could conduct the same curriculum evaluation tool that we were able to develop and implement at the University of Gondar. And then this same platform will house educational resources that we're currently developing, so that faculty from any educational institution all over the world could download those educational resources. In addition to the content, again, the disciplinary content is very important, but we also need to develop some of those cross-cutting resources, cross-cutting competencies. So we're also developing resources for teaching and pedagogy. We're developing gender resources to be able to support equitable teaching and making sure that we're reaching our veterinary students and our stakeholders in agriculture equitably across the countries that we're working in. So Ohio State's currently involved with developing an infectious disease epidemiology course, and hopefully within the next year that content will be available for essentially any educational institution in the world to access and utilize in their own educational programs. And this effort has very much been a partnership that started with this collaboration and has continued to involve the partners both at Ohio State and the University of Gondar. So just a couple thoughts about what I think makes a capacity building project successful. A practical need, clear objectives, always starting with the end in mind. A respect for culture and context, working closely with partners and making sure that you're keeping all the considerations for cultural acceptability in mind regarding just trying to be culturally competent and sensitive. Understanding the landscape, which is why it's critically important to work closely with partners. And there's a picture, and coincidentally with Dr. DeSalin and I, this was during the One Health Summer Institute last summer, another capacity building effort that we're involved in. So hopefully trying to help and build capacity now. So thank you so much.
Thank you so much, Dr. Berrien. I'd like to note that Dr. Berrien is also one of the key leaders of GOHi leadership, as well as a member of the executive committee for the Global One Health Initiative. And we will go ahead and take questions now. If you could either raise your hand or send me a message in chat, we will get to you.
project in Gondar has been started some years before, and it's a continuation of the previous project. So I think the team is building on the previous project, and I think this will be a great example for the rest of universities in Ethiopia as well as abroad. So my question is, I remember that Dr. Achenaf was involving veterinary schools in Ethiopia in the previous project. So now, are you able to invite other veterinary schools in Ethiopia while doing the project in Gondar?
Yes, the hope is that we would certainly involve other veterinary schools in the development and in the review and in the rollout of the materials. I know there's been a lot of interest in a lot of involvement of the other veterinary schools in Ethiopia during the twinning project. I know Dr. Armando Hoet, who's the lead for the OAE twinning program, who's currently on sabbatical in Rome. He was involving many of the universities regarding some of those evaluations, because my understanding is that the curriculum is standardized across the country. So making sure that there was buy-in and input from all of the universities that would be involved in instituting the curriculum in Ethiopia. So that's great in terms of getting that support and getting that feedback and input early on will hopefully allow us to be able, when we do create curriculum that's implemented at Gondar, it means that can be taken up by many of the institutions across Ethiopia.
Thank you so much.
We're willing to take any other questions.
Maybe there are no questions. You know, the last point, as you mentioned, involving other veterinary schools. You know, currently there are about 13 vet schools, and we know that they have a lot of problems. And I think it seems Gondar and some of the other schools are ahead. Especially Gondar has a great experience on twinning. So as you said, Amanda inviting other vet schools in some important workshops, as well as working with the Minister of Science and Higher Education. So whenever we do curriculum, usually the Minister of Science and Higher Education is invited to understand what we are doing, as well as to endorse some of the curriculum changes. Because changing the curriculum of the University of Gondar only will not be as impactful as involving as other vet schools. So whenever there are curriculum changing issues, it's good to invite vet schools, as well as people from the Ministry of Science and Higher Education who have a say on curriculum change always. Thank you.
Okay. Well, if we don't have any more questions, I'd like to thank you all for being here. Oh, we have one from Seleshi. You can, let me go ahead and unmute you.
Okay. So thank you very much. Especially need to pass my appreciation to Dr. Amanda for her very excellent presentation. Just to add with Dr. Desaling's comment, actually we have involved the Ministry of Education and the representatives. And the good thing is that this curriculum tuning nowadays, there is a so-called Dean's Forum at the national level. So Dr. Sagao, our Dean, has already presented this, and they have a very great appreciation and acceptance on this curriculum tuning program. So this is not only limited to the College of Veterinary Medicine at Gondar, but also at the national level, it is getting an acceptance. That's just to add.
Thank you, Dr. Seleshi.
Are there any more questions? If there are no further questions, I would like to thank everybody for joining us today. Our next webinar will be April 16th, and the topic will be wildlife diseases. Our speaker will be Dr. Rissa Pesapane, and I hope you can all join us then. Thank you so much for joining us today. Have a good day.
Thank you, Laura, everyone. Thanks.